Okay. Good evening, everyone. Today we'll start the last portion by me, andrology, and tell you the important points which are andrology. Firstly, we should know what is infertility. Infertility, it is the temporary loss of fertility. Okay. Then we have sterility, that is permanent loss of. Okay. These two terms, fertility and infertility, they are important. Then, if we talk about the Leydig cells, okay, if we talk about the Leydig cells, so we know that they are present outside the seminiferous tubules, outside seminiferous tubules. So, Leydig cell tumor, most common tumor in the case of dog, common tumor in case of dogs. Okay. Most common tumors in the case of dog, that is the Leydig cell tumor. We have to remember this thing. Okay. Then we have Sartori cells. Okay. So in the Sartori cells, these are present. These are present inside seminiferous tubules. We all know this, and they are basically responsible for feminization. It causes the feminization. This is important. Feminization. So two things. Leydig cells mein we have to remember this is the most common tumor in dogs. Okay, and in this it causes the feminization. Okay. Now we know there is the descendant of the testis. Okay, in the scrotum. So this is governed hormones. These are the insulin, and second hormone is the testosterone. These two hormones, these govern the descendant of testis in the in the scrotum. Okay. Now we'll see the spermatogenesis. These terms are important: infertility, sterility, Leydig cells, Sartori cells, descendant of testis, how it occurs. Now, next thing, that is we'll study about spermatogenesis. Important points regarding spermatogenesis. Okay. So, in the spermatogenesis, the first point is spermatocytogenesis. Okay. Spermatocytogenesis. This means process of conversion from spermatogonia to spermatid. Conversion of spermatogonia to spermatid, that is known as spermatocytogenesis. These terms are very important. Okay. Then second, spermiogenesis. Spermiogenesis. This spermiogenesis means it is conversion of spermatid to spermatozoa. Process of conversion of spermatid to spermatozoa. Then we have spermiation. The spermiation means release of spermatozoa in lumen of seminiferous tubules. Release of spermatozoa in the lumen of seminiferous tubule. Okay. Now you have to remember the sperm length. Okay? Sperm length. Sperm length is usually 50 to 70 micrometer. Okay? Now, remember these words: spermatocytogenesis, spermiogenesis, permeation, then the sperm length. Then we have spermatogenic cycle. Okay. So, spermatogenic cycle in bull is 13.5 days. Is 8.6 days. In ram, it is 12.2 days. Okay. Now we come to the next term is capacitation. Capacitation. So this capacitation, it occurs in female reproductive tract. In female reproductive tract. In female reproductive tract, where it occurs in the isthmus. It occurs in the isthmus. If we talk about the in vitro, so in vitro capacitation is done with the help of heparin. Okay, heparin is used for the in vitro capacitation. Okay, and one more point is there. This capacitation, it is a slow process. Okay, capacitation is a slow process. And one more like capacitation, acrosomal reaction. The acrosomal reaction, it is a fast process. Okay, capacitation is a slow process. Acrosomal reaction is a fast process. Reaction. What does acrosomal reaction? The acrosomal membrane. It's the fusion of outer acrosomal membrane plus plasmamembrane. Zomal membrane plus plasma membrane. Okay, when this fusion occurs, causes it helps it to penetrate in the zona pellucida layer. Okay, so it occurs for the penetration of sperm in zona pellucida layer. Zona pellucida layer में sperm को penetrate कराती है, ठीक है? And there it release hydrolytic enzymes. Okay, hydrolytic enzymes are released there. Now we were talking about the descendant of the testis, and we found that insulin and testosterone are responsible for the descendant. Apart them, there are animals in which testis is abdominant. Okay, so abdominal testis, these are normal. It's the elephant. It's the elephant in the whales and the birds. Okay, these are the three organisms. Remember them: elephant, bird, and whales. These are the organisms in which abdominal testes are present. Okay. Now, what is the main hormone for spermatogenesis? Which is the main hormone for the spermatogenesis? That is the FSH. So we'll talk about little about FSH hormone. FSH. Okay. Firstly, it is main hormone. It is main hormone for spermatogenesis. FSH. It is the main hormone for spermatogenesis. Second, this governs spermatogenesis up to secondary spermatocyte stage. It governs the genesis up to secondary spermatocyte stage. Okay, it governs the spermatogenesis up to secondary spermatocyte stage, and in Sartoli cells, in Sartoli cells, this FSH cause release cause release of inhibin. In Sartoli cells, it causes FSH causes release of inhibin. Okay. So very important. FSH is responsible for spermatogenesis up to secondary spermatocyte stage, and it causes release of inhibin in the Sartoli cells. Okay. Now we come to the semen characteristics. Okay. So firstly, we'll see the mass motility. If the mass motility is below 3, okay, below plus 3, it's okay, but below this, if it is having, the semen is discarded. Okay, one point. Second point, we come to the individual motility. Okay, so individual motility, the dilution we use is 1 is to 200, either RL or NaCl is used. Individual motility dilution 1 is to 200, either RL is used or NaCl is used. Now we come to sperm staining. So the sperm staining is with the eosin nigrosin. We can stain the sperm. Then Williams stain can be used to stain the sperm. Williams stain can be used. Then also the rose bengal can be used to stain the sperm. One more is there, that is the Loeffler's methylene blue. Loeffler's methylene blue. Okay. Andrology, you do the Rapidex and Nano. It will be enough. Okay. So this is the sperm staining. It can be done by eosin, nigrosin, Williams stain, rose bengal, and Loeffler's methylene blue. Now, how much amount of the dead sperms are acceptable? Dead sperm acceptable. How much amount it's acceptable? So it's 15, no. It's 10 to 20%. 10 to 20% of the dead sperm are acceptable. This question is somewhere asked. How much dead sperm are acceptable? 10 to 20%. Okay. Now we have the abnormal sperm acceptance. abnormal sperm acceptance. Okay, so abnormal sperm 15 to 20% is acceptable. 15 to 20%. These two things, these are very important. Dead sperm acceptance, abnormal sperm acceptance. Okay, so with defect in head 5%, with defect in tail 5%, then middle piece, it's 5 to 10%, and fused head it's 5 to 6%. Okay. Now we come to the different types of defect which comes in the sperm. Okay. So sperm defects which we see. So firstly there is the primary defect. Primary defect means manufacturing के टाइम पे जब हो रहा है, ठीक है? Defect in process of spermatogenesis. Defect in process of spermatogenesis. Okay, so this is the most severe type of defect. Defect in the process of spermatogenesis. This is the most severe type of defect. Then we come to the secondary defect. Secondary defect is during the transport. Okay, so defect in transport of sperm in male reproductive tract. Defect in transport of sperm in male reproductive tract. Okay. Now I have tertiary defect. This tertiary defect occurs when we do the handling of the semen. So during the handling of semen, the defect which comes, it's known as the tertiary defect. Okay. Now we'll talk about different types of secondary defects. Firstly, you have to remember this: what are primary defect, what are the secondary, what are tertiary defect. Then we come to the primary defect. We come to the primary defect. Sorry, secondary defect, not primary defect. Primary defect, we have the detached head, loose head. Then we have detached Galia capitis, detached Galia capitis. When this Galia capitis is detached, it gives you the half moon appearance. Half moon appearance. This basically occurs in the old age sperms. Okay, detached Galia capitis. Then we have next coiled middle piece. Coiled middle piece. Also, apart from this, if the protoplasmic droplet is present, protoplasmic droplet is present. Okay, so if it is 3%, it is not acceptable. Okay, 3% means not acceptable. नहीं होगा accept. It indicates the epididymal abnormality. है ना? Epididymal abnormality. It simply indicates the epididymal abnormality. Okay, simply indicates epididymal abnormality. Okay, now we come to the specific defects. Specific defect is knob defect. Congenital defect. Congenital defect. It is also acrosomal defect. These points are very important. Just mug it up. Acrosomal defect of defect is more GIMSA, GIMSA and eosin stain. Okay, so knob defect. Remember like this: it is congenital, it is acrosomal, it occurs in HF, and GIMSA and eosin stain are used. Now, next defect is the diadem defect. Diadem defect. Okay, so in this diadem defect, what happens is this is again congenital, but this is a nuclear membrane defect. This is a nuclear membrane defect. You have to remember this, it is a nuclear membrane defect. Then in this, we get the Carter nucleus. We get Carter nucleus, we get inverted Gallia capitis, inverted, sorry, inverted name, everted, everted Gallia capitis, and most important, beaded appearance. Beaded appearance. Okay, you can more appreciate this structure in, if you see in the net, just Google diadem defect, you can see the beaded appearance because of the everted Gallia capitis layer. Okay, now the next thing is DAG defect. DAG defect. So this DAG defect, in this what happens? Coiled tail. Coiled tail is there. In DAG defect, what happens is there is the coiled tail, and this is common in the Danish Jersey. This is very common in the Danish Jersey breed, and in this, what happens is zinc level increases. Here, the zinc level increases, and there is abnormal abnormal zinc level DAG defect abnormal caput epididymis is seen. Then we have decapitated stated. This is a hereditary defect. This is a hereditary defect. This is common in the Guernsey breed of cattle. Decapitated is a heredity of cattle, and it is due to head detachment. It is due to head detachment and of caput epididymis. Decapitated occur commonly in the Guernsey breed due to head detachment. Should remember all this. Okay. Now we have doe droplet. Okay. presence of dead granule on mid of sperm. Okay? When there is a presence of dense granule on the mid piece of the sperm, that is the pseudodroplet, then we have astheno, reduced sperm motility. Then we have necro. Necro means dead sperm. Then we have kerato. It means abnormal sperm. Okay? Kerato means abnormal, necro means dead, astheno means sperm having reduced motility. Okay. Now we have the two terms. They are the zoospermia and now we have अगर लिखा होगा zoospermia means it is asking about the concentration of sperm. ठीक है? And it's written spermia. Spermia means it's only for the semen. Okay. Zoospermia means sperm and spermia means for the semen. Okay. Then we have telogony. Yeah? And the telogony, this is a superstitious belief in the dog breeder. Superstitious belief in dog breeder, and they are having the belief that offspring of one sire of may acquire characteristics from sire which she previously born offspring. Okay. Offspring of one sire may acquire characteristics from sire which she previously born offsprings. Okay, this is the thing. Now we should know about the fractolytic index. Normal. The fractolytic index, sometimes it's asked. Normally it is 1.4 to 2 mg per hour. Okay, and we should also know about the MDRT values and resurgent reduction test normal value, that is 3 to 5 is the normal methylene view reduction, and this is 5 RRT value. Okay. Then we should know about the sperm specific enzymes. Sperm specific enzymes. So the sperm specific enzymes, these are the glutamate oxaloacetate transaminase, glutamate oxaloacetate transaminase, and hyaluronidase. This was also asked somewhere. Specific enzyme. These are glutamate oxaloacetate transaminase and hyaluronidase. Okay. Then we should also know the R value of this semen resisting to 1% NCA. That is the R value. Okay. R value क्या होता है? R value means value resistance to 1% NaCl. That is the R value, and it should not be less than 500. R value, it is the value which is resistant to 1% NaCl, and it should not be less than 500. Okay. Now we have already studied in this pathology. Philoposthitis means this is the inflammation of the penis and prepuce. Itis लगा हुआ है, inflammation of penis and prepuce. Then one more thing, it is asked in exam again, what is bailing up? Okay, this bailing up condition, this is seen in the case of pigs. Okay, and this is masturbation in prepucial cavity. Very important, bailing up. Okay, bailing up occurs in the pig. It is the masturbation in the prepucial cavity. Okay, now one more thing is there. These terms are very important. Remember it. Okay, next is pedericity. Pedericity. So, this pedericity is the rectal copulation. It is the rectal copulation, and this rectal copulation, it is seen in the case of pigs. Okay, then we have spermiostasis. Okay, spermiostasis. Spermiostasis, this defect is seen in ram and buck. This defect is seen in ram and buck, and this is a hereditary defect. Hereditary defect in corpus epididymis. Spermiostasis. It is seen basically in ram and buck, and it is a hereditary defect in the corpus epididymis. Then we have next, that is the spermatocele. These all terms are very important. Again and again I am saying, remember them by heart. Spermatocele is again a genetic defect. It is distension of epididymis with sperm. Okay, distension of epididymis with sperm, that is known as spermatocele. ये याद रखना है आपको. What is spermatocele? Spermatocytosis, pedericity, bailing up, and ये तो आपको पता ही होगा. और R value क्या होती है? This semen value which is resistant to 1% NaCl. Okay. Now the next thing which we have is the size of the fetal testis. Okay. Fetal testis. Fetal testis. Fetal testis, it is governed by two things. That is anti-Mullerian hormone and the fetal androgen. Anti-Mullerian hormone and the fetal androgen. Then testis size. It varies throughout the year in which species. There are two species in which testis size vary throughout the year. That is ram, camel, and stallion. Okay. Now we were studying about spermatogenesis. So these questions are also asked that one spermatogonia, it gives rise to 64 spermatid. Okay. Then one primary spermatocyte will give rise to 4 spermatid. Then one secondary spermatocyte will give rise to 2 sperm, and one spermatid will give rise to 1 sperm. है ना? These are very simple, but these are asked in the exam, so I told you. Now then we have to remember the chain of the sexual behavior steps. Okay, sexual behavior. This is all given in that Shukla book. Behavior stress steps. What are the steps in the sexual behavior? So first is there is the sexual arousal. Sexual arousal is there. After that, courtship. Courtship followed by penis erection. Penis erection followed by penis protrusion. Protrusion. Then we have mounting. Mounting. Then the intromission. Intromission. Then we have orgasm and ejaculation. And ejaculation. Then we have dismounting. And we have refractiveness. Okay, this is the thing. Sexual arousal, courtship, penis erection, penis protrusion, mounting, intromission, orgasm and ejaculation, dismounting, refractiveness. Okay. Now we have the. I'll give you the numbers, okay? Because numbers are also important in this andrology portion and the gynae portion. The thing with numbers is you just read them once, then before 2 to 3 days before the exam, just go through it, then it will be fine. Okay. I think last year some percentage was asked in my exam, so any one of the number will be asked from this. I'll give you the list of all the numbers. Okay, just go through it, and then 2 to 3 days before exam again go through it and then produce it in the exam. Okay, now I'll say that due to the decrease in vitamin A, calcium and phosphorus in the diet, okay, there occurs the delayed puberty. There is a delay in the puberty because of these things. Okay. Then we have, if there is deficiency of vitamin A, so there will be irreversible degeneration, irreversible degeneration, degeneration of seminiferous tubules. You all know this, na? Then, when in the embryonic stage, male जब develop होता है, so medulla portion में medullin hormone is there, and this medullin hormone develops the Wolffian duct or mesonephric duct. Mesonephric duct. Okay. Then when female is developed, so when female develops in the cortex portion, there occur cortexin hormone. Cortexin hormone, and this cortexin hormone forms the Mullerian duct, para mesonephric duct. ठीक है. Now, sometimes it is asked that from where this is from where the testis is originated. Huh? So, if origin of testis is asked, it is from the caudal pole of kidney. Okay. Then there is one structure called as the gubernaculum. Gubernaculum. This gubernaculum, it holds testis and it contain hyaluronic acid. Okay. Now, sometimes it is asked what are the basophilic hormones. ठीक है बेसोफिलिक हार्मोन कौन से होते हैं भाई FSH, LH, thyroid stimulating hormone and the adrenocorticotropic hormone. Then what are the acidophilic hormone? So they are the somatotropic hormone and lactotropic hormone, LTH, STH and LTH. Okay. Now the next thing is let's study little about the testosterone. वैसे तो everybody knows, but then also it is asked in the exam testosterone. ठीक है So we all know testosterone, it is responsible for sperm maturation, then secondary sexual characteristics, and urinary pattern in the male dogs, and territorial marking. जो टेरिटरी मार्किंग होती है ना इनकी, that is also because of this testosterone. ठीक है Okay. Now we have the next, that is the Sartori cells. We'll study little about Sartori cells also. That this Sartori cells here, it is involved in the conversion of testosterone to estrogen. ठीक है mediated by FSH. This reaction, conversion of testosterone to estrogen, this reaction is mediated by the FSH hormone. Secondly, they have to uh, here the testosterone is also converted into more potent form, that is the dihydrotestosterone. This is one of the question in the RapidX. Okay, so here it increases its potency. Testosterone potency is increased by this reaction. Then we have third thing, that is it produces inhibin. We have studied previously also inhibin, which gives negative feedback for the FSH प्रोडक्शन. इनहिबिन है तो नेगेटिव फीडबैक जाता है एफएसएच के लिए. ठीक है उसके बाद here it also androgen binding protein is also synthesized from this. Okay. Now I talked about FSH. In that FSH I told you that up to secondary spermatocyte stage, okay, up to secondary spermatocyte stage, FSH governs the spermatogenesis. First thing. Second thing, when this spermatozoa is sperm is going to the lumen, that the process spermiation. Spermiation is also governed by this FSH. Okay, remember this too. Spermiation. Okay. Okay. Now, what is the condition in old uncastrated dog? So, in the old uncastrated dog, because of the high testosterone level, the body has the high testosterone level. Because of that, there, okay, so there is the prostate gland hyper. Okay, there occurs the prostate gland hyper. Now some effects like this we completed about the hormone. These are the very important things. You just learn it by heart as it is. Okay. Now we have post-coital reaction. Post-coital reaction. In the case of buck, post-coital reaction is like licking of penis. In the case of buck, and in the case of ram, there occurs the neck stretching. Okay? Now, homosexual behavior. Homosexual behavior is seen by the cattle. Homosexual behavior is shown by the cattle. Then hermaphrodite. Hermaphrodite. This type of behavior is shown by the goat. Okay. Then we have the Coolidge effect. Coolidge effect. This is a novel female. Coolidge effect. It's a novel female in a group of male. Single male will be excited. ठीक है? इसका मतलब क्या होता है? Group of males. If single female present, then the male get excited. This is the Coolidge effect. Okay. Then next, free Martin females. 91.4% of them are sterile and 8.6% are fertile. ठीक है? अब what are high flankers? So high flankers, males in which testes descend by inguinal canal but not reach scrotum. That is high flankers. Okay. Now we'll deal with some diseases of this male reproductive tract. These are all very important things. Sometimes asked. You after reading this go with the ma'am occurs in another cells of ovary or in Sartoli cells. It occurs in the Sartoli cells. Dolly, it occurs in the Sartoli cells. Okay. Now we'll deal with some diseases, important diseases of this male reproductive tract. Okay. First is testicular hypoplasia. It contributes to 25% of total defect. 25% of total defect, and this is a congenital defect, unilateral. In most of the cases, it is unilateral and reduction in size is 2/3 to 1/3. Size reduction is there. Then sperm concentration and motility, it decreases. Also abnormal sperm, like it will be having giant cell, medusa head, protoplasmic droplet present. Here, if we talk about the spermatogenic epithelium, so it will be abnormal. ठीक है? Spermatogenic epithelium abnormal, but Leydig cell, they are very much normal. ठीक है? When one of the most important disease, testicular degeneration, testicular hypoplasia. Okay. Now we have next is testicular. Next disease, that is the degeneration. Okay. So it is 75% of the total defect. ठीक है? पहला point. Second point, it is acquired one and it is usually bilateral. It is bilateral in the most of the cases. Then this is reversible. Reversible. Okay. Now I'm rubbing this. In testicular degeneration, if we talk about the quality of the semen, okay, I'm talking about testicular degeneration. So in early stages, semen becomes thin. Early the later testicular testicular fibrosis, and once testicular fibrosis, now we come to the next disease, that is vesiculitis. Seminal vesiculitis. Okay. So seminal vesiculitis is decrease in fructose level, increase in pH, and decrease in motility in sperm. Okay. Seminal vesiculitis, there is decrease in the fructose level, there is increase in pH, and there is decrease in motility in the sperm. Okay. Now, next thing is cryptorchidism. Cryptorchidism. So, if we talk about this condition, cryptorchidism, in this cryptorchidism, there is normal testosterone production, but the sperm number it goes, and this is very much common in the horses. Okay, in the case of horses, this is very much common, and it is known as the such a type of horse is known as original rigs or riddling. Okay, ठीक है? Now this is rare in the cats. ठीक है? Is rare in cats. is prostate enlargement or prostate hyperplasia. Okay. So we know this prostate enlargement is because of high testosterone production in the old uncastrated dogs. So it is very common. It is very common in old uncastrated dog. Uncastrated dog. First point. Okay. Second point, if we go to the treatment, so first is the castration. Do the castration. It's the best treatment. If you are not going with the estrogen therapy, diethyl, diethyl, dithiocarbonate, diethyl, dithiocarbonate. This is used to zinc deposits in prostate. This is used to remove the zinc deposits in the prostate. Then we have penis deviation. Fees. अब इसमें दो आते हैं. If there is a ventral deviation that is known as the deviation होगी. There is a leg known as screw. It is known as corkscrew deviation of the penis. Okay. Now it is congenital. Good to fair.
Hello, ma'am.